So, Todd May, this June, you're going to give a workshop on the French philosopher Maurice Merleau-Ponty and his relevance for narrative therapy and perhaps for psychotherapy in general. Could you say a bit about how you see that Merleau-Ponty could be relevant for narrative therapy and for psychotherapy? What is it with this guy, Merleau-Ponty?
Merleau-Ponty, I think, often goes missing in contemporary thinking about therapy and even in narrative work because he comes from the generation before people like Michel Foucault, who were very influential. And yet I've argued that I think he is, particularly for narrative practice, the missing theorist. Because what walks into an office when consulting work is going on or when leadership work is going on is a body, somebody, an embodied person. And what Merleau-Ponty thinks about and what he gives us an account of is what that embodied person is, what their character is. And so he allows us to think about, in human ways, the person in front of us in a way that other theorists don't do as well. I think this is really important for narrative therapy because the account that he gives is one that can go along with the thought of people like Michel Foucault. And I think because narrative therapy itself is a way of working that's often better than many other therapies, I think this is a contribution to therapeutic practice in general.
So what are some of the main concepts that Maurice Merleau-Ponty is offering?
Let me just talk about one. For instance, he says that our history sediments in us, right? that it accretes in us, but not in a way that you have to discover a single core of yourself, but in a way that allows us to think about our history and to think about the stories we tell about that sedimentation and be able to tell other ones that are going to be more empowering for us moving forward.
Yeah. And could you say a bit about Merleau-Ponty's concept of the phantom limb and how that is relevant in narrative therapy?
Yes, because the phantom limb is about how we orient our body toward the world. So, for instance, a person who experiences a phantom limb experiences being in the world with their limb still there, often in the way of it being painful, but the limb isn't theirs. So what's happening here? It isn't simply that they're just receiving messages from the world, but they're participating in orienting themselves to the world.
So it is as if the body has a language of its own, and I know that the term prereflexive is central here.
Yes, that our bodies have a pre-reflective relation to the world. They move through the world. They understand the world even before we understand it reflectively.
Yeah. So could we say that the term pre-reflective is a better way of understanding what might be called unconscious or non-conscious processes in other theories?
Absolutely. In fact, I think what it does, it gives us a way of thinking about what we do unconsciously and even up to things like self-deception without our having to posit this unconscious place in our mind.
Yeah. Could you say a bit about this concept of self-deception in which we might say fool ourselves or avoid some stories? Or could you say a bit about this concept?
Sure. I think all of us, to some degree or another, engage in self-deception. So it's not clear we could actually make it through the world, right, if we didn't deceive ourselves about something or another. But what we have to do is understand how it is that we can deceive ourselves. And Merleau-Ponty offers a view that allows us to think about self-deception, not by positing an unconscious into which our thoughts go, but places in our sedimentation that we'd rather not look at.
And we would rather not look at it because it might be filled with anxiety or unease or something like that.
Exactly. So when we might move toward that thought or move to that sedimented part of our history, we begin to feel anxious, and so we tell ourselves a story that's going to bring us away from it.
Okay. Thank you very much. We look forward to this workshop.
Thank you so much, Alan.